happened twice. I asked for the bill for my wife, knowing that, there would be more coming. And they did print something out for me and give it to me. And then I came back 2 weeks later, and I asked for an updated billing. And they said they couldn't give me one. I said, well, give me what is my current billing today. And they said, well, we can't give you one. I said, well, you gave me one on the way out the door. And I was told to come back, and you would give me an updated one so I could make arrangements to make payment. And I actually gave them like a $2,300 check or something because I could. And I knew what was going to be covered, what was not going to be covered. And I had the money. And so I made a payment and said, put this down. And so when I went back and said, okay, now show me what my balance is, they said, well, you're going to have to go to the business office. And the business office, and they said, you made a payment? I said, yeah, I made a payment. I came in and made a payment. And so why isn't it reflected here? And they said, well, can you give us a couple of days and we'll find it? I said, okay. I came back and I asked the questions again, and they said, sorry, we don't know what happened to that. I said, so that means, why would I keep paying you if what I'm paying you doesn't get credited against my bill? And if you're going to keep adding charges to the bill after discharge, why am I paying against a moving target? Why should I do this? If you can't tell me how much I'm being billed and for what, why should I give you any money? I said, look, I pulled out my checkbook. I'm ready to pay you if you can just give me a definitive bill. And they said, well, that's the amount. They pointed to a single page, like basically an invoice, that they didn't produce until I walked in the office and asked for it. I said, sorry, I don't do business this way. I won't do business this way. And they said, well, we're going to have to refer you to a collection. I said, okay, go ahead. And then I'll ask the collection to take me to court. And then when we go to court, I'll say, can you please show me the detail of what you're charging for this for? I will ask the same questions, but if I have to, I'll go to court. And I'll get the answers, and I'll pay a reasonable bill. And what happened? They garnished my tax refunds for 3 years, 4 years, maybe 5 years. And I would go up to the hospital and I'd say, okay, now against my bill. And they said, we don't know. We think so, but we can't verify to you that that's what's being done. I said, so for as far as we're concerned here, you are still carrying the full amount of my bill on your receivables. And you're telling the legislature that you can't collect that. And you need for the legislature to appropriate you, I think it was like $14 million that year. You want $14 million to make up for the part that I didn't pay. But you garnished my tax refunds 5 years in a row, and you didn't credit it. So where's that money? Are you starting to get the picture here of what's going on at GMH? And if it's been going on for over 20 years, my boys are 15 and 12. And it hasn't changed. It's just like, and this is where the point of the articles in the Post and the PDN, they kind of miss the point. Let's excavate the point. The point is that this loose accounting and the unrestricted hiring, the loosey-goosey procurement, and questionable vendor payments, scheduled vendor payments, and contracts for things like radiology services have been going on for a long time. When I worked for Jesse Lujan, we had a running battle with GMH, the folks over at GMH, over this. They hated us over there for digging into this. But it's a game. It's a big game. Annual multi-million-dollar requests to make up for the shortfall, and unrestricted spending and loose procurement and contracts on the other end. And they hold the self-pay, the people of Guam unable to pay their bills, the self-pay and the migrants as citing them as ready to blame. Blame these guys. That's why we can't keep things going over here. These are people who get paid $120,000 a year. With a straight face, they will tell you that. They will go before the legislature and say, we're working hard to deliver medical services every day. Don't think that we're just sitting around. But it's the administration versus the hospital administration versus the medicine. If you talk to the medical staff, they'll say that the work is getting done despite the administrators. They have to kind of scratch and claw to get stuff. Sometimes the services are not really smooth because they don't have all the radiology services they're supposed to have to do a straightforward diagnosis. It takes a long time to get the results back, or they don't have the right machine on working at the time. And this is why I take my dad straight to GRMC. And what do? They don't bother setting up an outpatient clinic, or contracting out for outpatient services somewhere else, or setting up the government of Guam generally, setting up outpatient clinics at the two big public health centers in Mangilao and Dedido. They just have people go into GMH, and then they charge them ER fees on a self-pay basis, which makes no sense. Yeah, you go to the hospital if you got, car accident, broken neck, fell out of a tree. Yeah. Or you should be able to go to public health in Dedido and then be transported from there. Stabilized and transported. But that's not how health care is being administered by the government of Guam for the operations within its purview. That's the way it's being done in the private sector. It's how it's being done at the clinics that are sprouting up around town, the individual doctors' offices, specialty care, radiology care, cancer care. GMH they can corner the market. Instead, they're wasting their time playing this game of, we can't count the money. We have a purposely difficult way of tracking cost, so that you cannot track costs. But as long as we manage the general parameters of it, there's plenty of money to hire and to spend on things that are needed, but wanted, not necessarily needed. It's like a gambling den. There's a lot of loose money, and somebody is benefiting from this. If it can last 20 plus years, then there are people who are benefiting from this, and there's only one person who's actually in charge of that hospital under the laws of Guam, and that is the governor. And so The governor is responsible. And now that we have a new governor, that governor, being responsible, now has to account for the activities at the hospital and the game that's being played. And now that we have an OPA who knows how to dig and write a report on what he's found, and we can expect to have more action. The feds are not happy with it. Playing brinksmanship with the feds and the payments. But in fact, there's enough money in the government of Guam budget and grants being put forth, and the power of the government to use that weight within the market within the market for health care on Guam to come up with an optimal setup, not anarchic as it is now, but optimal allocation of services, payments, payment levels. There was one comment that was made about getting as many people as possible. There. In order to cut losses, self-pay patients who don't pay their hospital bills cost the hospital about $30 million a year. Hospital officials told Governor Leon Guerrero earlier this month when she toured the hospital. In order to cut those losses, Leon Guerrero said the administration plans to enroll as many uninsured patients as possible in medical welfare programs. Does that sound like universal health insurance? Does it sound like Obamacare? It doesn't extend out here, but using the structure to get as many people into an insurance model where it's not where there's somebody who's going to review the utilization review to make sure that the bills are not padded and the fees are either in line or the light is shining on them that they're not in line. But those folks up at the hospital have got to look at the fee schedules and make them more realistic. 30 years ago, when I was reviewing the fees, and believe me, this has not changed. I sat down with the hospital officials in a meeting with the hospital officials over lunch one day. A meeting that was arranged by a friend of mine, and we asked some hard questions because this is when they were going to the getting ready to go to the legislature, or just after that, and they were wondering why it was that they were not getting a lot of sympathy and traction with the public in support of their request for the millions of dollars they were requesting. And I asked whether the fee schedule was any different than it was 30 years ago. And they said no, it's pretty much the same with new pharmaceuticals and new procedures added. But imagine this. You take an item that's on that formulary, and it's not the price, the GSA pricing, that government-affiliated hospitals throughout the nation can get from the pharmaceuticals that's negotiated by the feds. But it's another base price. Why is it that base price? It's because we buy on the retail market. I'll continue this. So the caller on line one. Line one, go ahead. You're on the air with Tall Tales.
Daryl, good afternoon. This is Jack. How you doing?
Hello, Jack. Thank you very much for calling. I'm doing okay waiting for you to call.
Yeah, just been busy. I got home, and I've been listening for a while. And can I tell you what the root of the problem here is with GMH?
From your perspective, what does that elephant look like?
Well, here's the thing, is that when we listen to our elected leaders, they make it sound like health care is a right.
Okay, go ahead.
That's the problem. I mean, do you view health care as a right?
Are you asking me?
Yeah.
Okay. In in the Organic Act, health care on Guam is a responsibility under the law, under federal law of the governor. And
Well,
this has been
all that.
and
you
then
think it's right?
no, but let's look at the roots of this, okay? Because we're not. This community doesn't come from a heritage of you have your own medicine if you are if you're living out in the frontier, or you know that there's a doctor. The American communities as they've evolved over the last 200 years. Okay, that's not our heritage here. The heritage for medicine on Guam was Surahanas, and then it was the ship's surgeons during the whaling time, where there was a kind of medicine that was brought in because of the ships that were coming in and bringing in disease, and whatever the Europeans understood about the disease, however they were transmitted, smallpox, measles, stuff like that. So then it was the naval government, and the U.S. naval government had sanitation standards, and they built a hospital in Naganya, and it was health care provided by the Navy as a matter of administration of this naval base Guam. And then in 1950, that was turned over to the government of Guam to be run exactly the same way. And my mother was part of the public health, or the native nurses under the Navy in the late 40s. And then it sort of morphed into the U.S. Naval Hospital Guam, over here in Tamuning, by St. Anthony, was turned over to the government of Guam to run. And then a new hospital was built up at Hospital Point in 1959. And then the U.S. Congress was asked to replace that hospital that was damaged badly during Karen, to replace it and with the new hospital that was built by the church, right? The church built the hospital that we go to now. And that was the Catholic Church on Guam built that church, and then they basically got the government of Guam got a grant from the Congress to buy the hospital from the church. And I should mention that the church helped administer and run GMH out at Hospital Point in the 60s with administrators. And so there was a close tie-in, but then we wanted to get away from the involvement of the church, so we bought them out in the 70s. And then we made renovations, and they ran the hospital as we know now. And there hasn't been very many changes from the 70s to the 80s, and then 80s to now. And then we've had public health, which has been whatever the public health doctors coming out here and then building public health for all the different programs from the Great Society. So here we have this provision of health care from public health to GMH, and the policy that nobody would be turned away because of ability to pay. Those three, that's the heritage. And so you're talking about health care as a right. This is not the same as a blanket policy. It's sort of evolved. It's been that the government provides health care. And how do you roll that back? How do you say, okay, never mind, you stay sick or you stay injured, you get outside the door and you have your own, you go bleed over there. Go cough over there. We don't have that in our heritage. Nobody on Guam has it in their heritage. And so when you ask the question about, healthcare as a right, it's kind of the same thing, but it's coming at it at a different angle. So is
healthcare a right?
Is healthcare a right? It is a government program. It is expected it's a government service.
No, it's not. Okay, let's back up a second. All right, there's a few gaps that you're missing. Do you remember what the Guam Memorial Health Plan was?
Yes.
What was it?
Well, it was a
An attempt.
well, actually, I read one of the last brochures they put out. It was a way to try to collect as many people under a health insurance plan that the government would fund.
And why was that? Why was that all set up?
In order to bring utilization review.
Was
Private.
Medicare in existence at the time?
I think it was. It
yes.
was.
And so what
yes.
happened? Why wasn't Guam included in Medicare back then?
Oh, we were. It was a high copayment. Guam had a high.
So Guam thought
payment.
that the government of Guam thought they could do a better job. Let's just cut through the chase and say that government Guam thought they could do a better job.
Well, actually, we could do a better job if we had the same reimbursement rates as in the States. But
okay, so it's not about health care, all right? First off, you got to look at this. I'm going to try to explain it because I gave you a lot of time.
Well, no, I want you to explain.
Expecting the reciprocal here. So can you give me a second?
I want you to.
Let me explain from my position.
Yes, please. I want you to.
Health care is not a right. It's a commodity, all right? It's a commodity. Even if you look at the rights that are guaranteed by us, freedom of the press, freedom of speech, freedom of assembly, freedom to petition, all our rights, even the Second Amendment right, none of those are funded by the government. That's why education and health care, the politicians and those are running, they convolate. What they do is they conflate the issue into terms like, we're going to provide better health care. They're not providing better health care. What they're trying to figure out is who gets stuck with the bill at the end of the day. Now, for me, I'm in the private sector. Basically, I'm covered by catastrophic care through 3 government programs. One is MIP, one is Medicaid, and the other one is Medicare. Now, I'm in the private sector. Now, how about government? How about government employees? How are they covered? Well, for government employees, it's a commodity. So they get the choice of going out there and why aren't they covered on the same catastrophic care as I am, as a taxpayer, as a private citizen, as someone that's working in the private sector? Why are our government workers not covered under the same 3 M's? Now, I told my nephews, my nieces, I said, really, if you really want to make money and you're interested in health care, don't be a doctor. Don't be a nurse. Go into coding. Figure out how billing is doing. Go into accounting. Learn how to do code, billing codes. Learn how to get your money from CMS. Learn how to get, because here's the thing. And I'm going to let you in. Government of Guam is a third-party payer. They're not the primary users of health care. They're not the secondary users of health care. They're third-party payers. So, as a third-party payers, you don't really care about cost. How many budget hearings have you went to, and they're not discussing about how to keep costs low. They say, what's your budget? Okay, how do we meet that budget? They're not discussing about how to keep costs low because that's not their job. Their job is you submit your budget. Their job is to try to figure out how to get the money to you. And every year it's the same thing. Didn't we give you proper funding? Why didn't we fund this for you? It doesn't matter whether it's the hospital, whether it's education. It's the same argument every year, okay? Because education and health care are not rights. They're commodities. And if they weren't commodities, then there would be no private sector involved in these ventures because there would be no profit for them. But because they are commodities, they're involved. And that's the big problem. That really is the big problem here, is that people keep thinking like, we need better health care on Guam. No, we don't. What we need to do is figure out who's paying for what, at what cost are we willing to pay for it. You know, when a relative of mine passed away back in 2009, you know, as a guarantor for the billing, I signed my name on that, and I wanted an itemized receipt for everything. And you know that little bucket they give you with the tub, the toothpaste. You know, sometimes it has a comb. You know how much that one costs?
How much?
That plastic stuff with all the goodies. Sometimes, you know, it depends. If you're lucky, you get some that's complete. Some are missing the slippers. You know which one I'm talking about, right?
Yes, of course. Yes.
You know how much that cost?
Bedpan and whatnot. Yeah, how much?
Do you know how much that cost back then? It was over $250. Something you could have gone down to back in the day. It used to be the dollar store.
Yeah.
Now it's $1.99. Thank you, Gov. Glom, for raising taxes.
Yeah.
So you know, we need to move away from the lip service and get down to the reality of stuff. I met a doctor who just started his practice here in Guam. You know what he is? He's both the physician. He's both the nurse. He's also the coder. He's just having a hard time. And you know, I admit that we do need an administrative portion for what's that, Guam Memorial Hospital. But you need somebody that understands coding and billing. And it's not just a single year thing, because it changes from year to year. You know?
Well, there are people who understand coding and billing very well. They work for the insurance companies, and then they negotiate back with the hospital. And no matter how,
here's the thing: we need to move away. Health care is not a right; it's a commodity. It's a commodity, and whether you know you want to believe it or not, we do have catastrophic care here. We do have catastrophic care. And unfortunately for us in the private sector, that's what it boils down for us most of the time. We don't have the carte blanche 60-40 split or 70-30 split that the government enjoys and its workers. So, you know,
and
if
we also
you
don't
want to address the problem, you need to get those workers under the same programs that the rest of us have to fall under, the 3 M's. Medicare, Medicaid, and MIP. That's how you solve the problem. But if one part of the government treats it as a commodity, and then it leaves the dregs off the table for the rest of us, I mean that's what happens.
Do you think the private market, is bigger than the Gov Guam market?
This is what I believe. I think there's some fudging of the numbers, because all the people that I know, that I work with on the private side, when they say executive checkup, that means they go in to their own doctor, and you know they might pay a co-payment, they might meet their deductible, but for some reason when I hear some sort of government employee say an executive checkup, they get a ticket to the Philippines. You know, they stay there for a week. While they're there, they might consider investing on a condo or a timeshare. I mean, it's just ridiculous. It just boggles my mind. You know how healthcare is done in this. But you know, I realize, you know, that until people figure it out.
Well, you know, this kind of touches on another subject I'm going to bring up. It's whenever it's like really slow news day, and that has to do with the definition of socialism and how socialism is being bandied around as a reason to fear socialism coming to the United States.
You just need to recognize the process and see how people are treated.
Well, and that's something that I really want to drill down to here as we're talking about GMH. Thank you so much for your comments, Jack.
Have a good day,
really appreciate it. Okay. And that was our friend Jack that calls every now and then, and good to hear him on Tall Tales today. Let's take a break here, and we'll come back with more Tall Tales.
Hi, welcome to this Subway ad for our all-new Ultimate Cheesy Garlic Bread. How would you like it?
I'll take a skeptical grandma.
Set in her ways?
A smidge.
Grandma, try this ultimate meatball marinara made with ultimate cheesy garlic bread. Melted mozzarella, parmesan, garlic butter spread. It's just like yours.
Like mine? My grandmother's recipe?
Try it.
You know, my grandmother's cheesy garlic bread was never all that.
Subway, make it what you want. Limited time only at participating restaurants.
The Extra Point with Jerry Roberts of Guam Training every morning on The Ray Gibson Show.
Everybody wants to say yes to happiness, but too many of us forget to say no to the things that often prevent it. I'm Jerry Roberts, and I got my hands on an updated list of the stuff we need to turn our backs on.
You can find daily transcripts of The Extra Point at guamtraining.com. Tune in every weekday morning at 7:20 for The Extra Point with Jerry Roberts. Brought to you by Guahan Insurance Services and First Hawaiian Bank on 93.3 The Point.
And welcome back to Tall Tales. Before the break, we were talking with Jack about the topic, one of the great topics of the day, which is GMH being audited and having to do with its self-pay collections. And before Jack called, I was talking about my experience with their billing. Now, you know, I've worked with the legislature on reviewing their budget and their formulary for the approval of their fee schedules. I've worked in the medical records department to make sure that the records were straight. I did some proofreading for GMHP and met the folks there who were doing reviews of what the hospital records were like coming down to be paid by an insurance company, and the person who was doing the reviewing. You'd be surprised if it was, I mean, she's retired now, but it was, I heard it from someone who really knew how to look at a chart and say, no, these charges are not really part of this, not properly part of this, admission. And then, let's see, where else did I work? Well, I've had, responsible for making payments for a couple of children. And I can see where it's just a job, and it's a hospital that people have to go to. It's like, okay, it's a monopoly, and whoever expects it to be any better than it is. If you want something better, there's the airplane. Go. And if you come in here, we'll take care of you, and we won't bother you about a bill, because we can clearly see you don't look like you're able to pay. But it's okay. We get budgeted, as Jack was saying. So, no, it may not be a right. It may be a commodity, but it's a commodity that's on the GovGuam budget to be provided to make up the shortfall in in health insurance or any of the federal programs cover. Even the possibility or the potential for using a health insurance model to cover people in the community who are not covered, which is the Obamacare, universal health insurance from Massachusetts or Hawaii, those models. Oh, that was another thing I did, was I put together a bill when I was working at the legislature for my senator to introduce to adopt the Hawaii style of universal health care for private sector and the unemployed. Sort of so there's a spectrum between the government programs and the people who can afford their own health insurance, but to cover the middle. And it has to do with using insurance or putting enough money in to have a stable market and an efficient market. But I don't see that happening here, not because it shouldn't happen, but I just don't see it's not in anyone's interest to organize the market. Certainly not the individual insurance companies. And the government of Guam doesn't want to be administering a market for health care, even though they own most of it. They don't want to pass a policy for universal health care so that they manage health care on this island. They're just happy to have this multi-million-dollar game going on over at GMH. That there's medicine going on, but there's a whole other aspect that is a valuable activity of money flushing through in and out, unaccounted for money. That is valuable to a number of people, and and the rest of us are getting our chains yanked, to be emotional about the hospital, or to be thinking that it's too much of a problem to deal with, or we don't want to undermine or discourage the people that work hard at the hospital day in, day out. And that's not the issue. The issue is whether we're spending too much money on inefficiency, and that budget, we could reduce the amount of money that the hospital really needs for its medical mission by reducing the amount that is the inefficiency in the administrative part of the mission. And then the legislature might save $10 million a year and have the exact same services being provided by the hospital. And maybe there's $10 million saved that could be going into capital improvements of $10 million a year by the hospital, methodically retiring out aging plant and investing methodically in new plant. But even that's something that the government of Guam doesn't do. It should be doing. And so that's what we're really talking about today. And yeah, it's a very large issue. It's like that, describing the issue from being a blind man. How many 10 blind men trying to describe an elephant? And so that's what we're being faced with here. And we, Joe Public, we're asked to have confidence in our leaders and in the medical community that is using GMH as a base for providing us medical care. And it just keeps ringing more and more hollow all the time. And this argument's sort of falling apart. It's getting old. And so somebody's going to have to come up with a new game or stop playing the games here, but they can't until they create a game somewhere else. And we have to just watch out for that. But we're not able to solve. We're not going to solve all the problems this afternoon, but it sure does help to have B.J. Cruz at the public auditor's chair, generating some discussion and pulling out some details for us to discuss and to put some pressure on our leaders to be taking into account that this is happening while we're watching. It's not hidden anymore. For those of you who might be trying to find me on Facebook, we are having a problem indeed with our Facebook Live, and so we regret that. You are finding me on the air. on broadcast radio, but maybe not online. I don't know if if the audio is available. I'm not able to find it as I pull it up on my computer here.
You're also on YouTube Live, though.
Okay, so YouTube Live is on?
Yeah, all they have to do is go to YouTube and type in Bob Klitzkie, and then the page will show up, and they can watch as well there.
Oh, my goodness. Well, yeah. I guess if this is going on tomorrow, we should mention that at the beginning of the show, and then and periodically throughout.
Yeah.
But thank you. I'm glad that we are there, and there are many people who have already started using these other means of getting to this show. I'm a broadcaster myself, so I understand analog transmitters and antennas and links, turntables and microphones and the connections. Not the digital connections and the digital distribution. I'm happy to rely on people to take care of that, and I think that that's a good way to earn a living these days, to be in those kinds of distribution media. And so hopefully we'll have the Facebook Live side back up tomorrow. And so we were also looking today at, well, the bill isn't, last time I looked, it wasn't available. Bill number 54 that would put term limits on senators, three-term limits. And this topic has come up a number of times in the past, and it's good if you don't like the ones who have been in for a long time. And it's not good if you do like the ones who have been in for a long time. But it's funny to have the author of the bill be someone who's been in politics for quite some time now and has been making a living at it and understands the revolving door very well, taking the position that politicians should have limits for the elected terms. The people should not be allowed to elect their representatives for more than 6 years at a time. It's 10 minutes till 6, and let's take another short break here and come back with more Tall Tales.
At Chili's, our burgers stack up with anyone's. Handcrafted to order, smashed to lock in flavor on a toasted brioche bun. Our burgers are all kinds of perfect. Choose from the Chili's Chili, the Mushroom Swiss, the Ultimate Bacon, or you know what? We dare you to take on the Boss Burger. Loaded with smoked brisket, rib meat, jalapeno cheddar sausage, and bacon. We may have really out-burgered ourselves. Our burgers are more than a handful, served with garlic dill pickles and fries. So hurry in today and enjoy our juicy, melty, yummy, handcrafted creations. Perfection between two buns. Chili's, more life happens here.
Here at APL, our core values give the company its heart and soul. Whether it's connecting your business with our global network through our newly enhanced service or investing our efforts into giving back to the community, APL is committed to serving you. We humbly honor the opportunity to find innovative solutions for you and your business. To learn more about our enhanced service, call 588-4651 or visit www.apl.com/Guam for more details.
Okay, welcome back. We've got about another 8 or so minutes, 7 minutes together here. If you want to get a word in edgewise, 888-8255 is our telephone number. We've heard from Ken, and we've heard from Jack today. You can be next. We still have a few minutes here. The bill from Telo Taitagui to limit terms of the elected leaders. These terms are set by, or at least the power for us, the people, to elect our representatives has been granted to us by the Organic Act. And so in the article it says, Taitagui cited a 2013 Attorney General opinion advising the Guam legislature to follow the more conservative approach on the issue by acknowledging the terms as a qualification for legislative office established by the Organic Act of Guam, which cannot be changed, added to, or diminished without congressional action. So Titagui says that the legislature is given the right to exercise discretion as to how many members it shall have within the set maximum, and by implication, it can be further held that the legislature has the right to exercise similar discretion in determining the terms for which its members shall hold office. It's one thing to have the legislature given powers on how it will organize itself. That's the legislative branch is allowed to organize itself. And she's saying that the legislature can say that we will only recognize elected candidates who have not served 3 consecutive terms in a row. If you've served 3 consecutive terms in a row, we will not seat you. But the Organic Act of Guam provides for voters to select senators. So it is the right of the voters to select by vote who will sit in the legislature. And so it sounds like they're talking past each other, the Attorney General and the sponsor of the bill. Whatever you think of the merits, it is still grounded in federal, the federal organization of our government. It is not our own locally constituted government under our own constitution, our own organization that's been reviewed and approved by Congress. So because that's how it's organized, we may not be able to limit terms, whether you think that's good or bad. It's simply not ours to decide. Our decisions are made at the ballot box, not by the legislature saying, limiting what the voters can do. That's basically how that breaks down. But that's the latest bill, Bill 54-35. Not posted yet online, but when it is, I'll have a copy of it. I was trying to tune in today to the session, but it was kind of difficult to follow what they were doing. I saw a couple of senators wringing their hands over the uncertainty faced by GovGuam employees if they can't have GRMC as an option, and the numbers have been thrown around, but they are nobody seems to be able to say these are good numbers and these are not good numbers. Even government employees will not come down and say definitively that which numbers are the good numbers and which numbers the senators need to pay attention to. And of course, the senators don't have enough, haven't hired the people who are going to tell them which numbers are the good numbers. They could have, they still can, but if they haven't, and they're going to rely on the executive branch to tell them, well then, that's already an admission of both ignorance and weakness, and that's it's a pretty sad spectacle. Also, I saw some hand-wringing over how much is this going to cost taxpayers to make sure that the GovGuam employees are taken care of, as if it is GovGuam employees versus everyone else. And there was a little touch of that in Jack, but is that the point? You want to take away something that you don't have? Don't want to have to pay for somebody else to have it? That kind of that is a sentiment it's often found of people who want to hang on to more of their earnings, their hard-earned money, and not have to pay for something that protects the next guy. And when that sentiment is given full reign, it's not a pretty sight. And when we go the other direction and we all contribute and spend wisely to take care of some of the rough spots in our community, it turns out to be one of those times that we can look back on and say we were really great then. I'm Daryl Taggarty. I've been sitting in for the vacationing Bob Klitzkie, who will be back in 9 days. It's time for us to close out Tall Tales for Tuesday, February 26th. And I'll be back again tomorrow afternoon at 4. Ray Gibson will be here with the Ray Gibson Show tomorrow morning at 6 until 10. Do stay tuned for more fine programming throughout the day and evening here on The Point.